Pleasure to have you join us today on the program Healthy Living. I'm Adisu Walsa, and today we're going to be looking at yet another topic of interest that will be beneficial to you and to every other person around you, because it is something that is being done almost every day, everywhere, all over the world. But it's just that in some areas is more in some areas than others, but it is something that is being done, and if nothing is done about it, there's going to be a serious problem in the world. Already we're seeing young ones on the street, half naked, incoherent in whatever they do. You see old ones, but more worrisome is the issue of seeing young children on the street, children under 20, misbehaving, out of their senses, not aware of what they are doing, or who is talking to them, or the way they are dressed. And you wonder what is happening. Some people will say home trouble, others will say I didn't do them. But we've come to realize that 90% of these kids, I want to call them kids, that you see on the street, almost running mad, or even have gotten to that point, is as a result of substance abuse. What particular substance? These are many more we're going to be looking at today on the program Healthy Living. And I have with me in the studio a gentleman and a doctor. He's a consultant psychiatrist from the University of Benin and Teaching Hospital. Join me as I make welcome Dr. Aina Israel. Happy to have you join us on the program. Okay, so you guys are still enjoying your anniversary.
Yes, the 50th anniversary.
Yes, that's beautiful. Somebody called me to say, a health woman. All consultants are very busy somewhere else, and the hospitals, the clinics are kind of very filled up with people.
That's true.
Okay, but I'm sure after this program you find time to go back to the clinic.
Definitely.
All right, Dr. Aina, it's a pleasure to have you join us today. I want to look at substance abuse and, of course, phone addiction, because if you go on the street, like some of us who do, field work, we see quite a number of things that were not there before. And, we begin to wonder, is it as a result of civilization? Is it because of the internet? Is it because the world is now a global village? Is that why we're seeing all of this? And it happens amongst youth who do sports drinks. You just name it, all sort of things. I saw somebody with a drink the other day. I thought it was seasoning. I was like, now only one kind of seasoning you buy. He said, no, this is not seasoning, it's drink. I said, drink? Wow. Wahala deal. All right, so I want to look at substance abuse and phone addiction. So, Dr. Aina, let's start with substance abuse. When we say substance abuse, exactly what are we talking about?
Thank you very much, Adiswa. So,
you're welcome.
When we talk about substance abuse,
yes,
we are referring to the pattern of use of some items that people consume that are considered to affect their psychological functions. So when there is anything an individual takes into the body,
yes,
and it has an impact on the way the person thinks, the way the person behaves, the way the person feels, or the way the person perceives the world and things around him, we say that that item has impacted on the psychological function of the person. So anything that falls into that category is what we refer to as substance abuse.
Okay.
So substances can either be something that is naturally occurring, that is growing, that people take, or it could be something that in the laboratory is combined together to produce a particular chemical that people now use to get some pleasure. So when people use these things in a way that is not medically approved, and it begins to affect their mind, in summary, we say that that is substance abuse.
Okay. So what are the items that are commonly abused?
Okay.
By youth. Now let's use the youth as our focus for today.
Okay, good. Common in our environment include alcohol. We also have the common cigarettes.
Okay.
These are very common and readily available. And but many young people go beyond those simple and readily available agents to now begin to use other substances that are a bit not readily available. They have to go out of their way sometimes to get them.
To get them.
So we have things like India hemp, and it comes with various names in different environments. We also have things like cocaine. We have cocaine also. We also have heroin in the environment. And then, of course, there are a few other things like the amphetamines. Those are a bit more technical in terms of name. So, and many other things that are surrounding this. Now, there are a few drugs that are used in the hospital.
Okay,
that
are
people also
prescription
tend,
medicines.
yes, that people also tend to use wrongly. And many of them are strong pain-relieving drugs. Like, it's been the news for a while now that people use tramadol and abuse it. That is one of them. Of course, pentazocine is a drug that is commonly used to take care of pain. So some people also abuse that. Of course, we have other ones like pethidine, we have things like morphine and all of that. So these are strong pain-relieving drugs that are normally
that are used in the
hospital.
hospitals.
But some people, for whatever reason, maybe at a point they had a health problem and they had severe pain and they were prescribed this drug. But beyond the time of the approved use, they may find themselves still continuing to use those drugs. So they're also available. And then it will be interesting to know that some drug stores may actually sell these drugs to people and may not scrutinize their prescription.
Aren't those drugs supposed to be used only in the hospitals? How come we have them on the streets?
Well, the drugs are meant to be prescribed by a doctor, who is expected to have evaluated the person and decided that this person needs the drug. So when the prescription is taken to the pharmacy, it is expected that it is not all drugstores that should store some of these drugs because they are well controlled.
Yes.
So different categories of these drugs are stored in different categories of pharmacy, but sometimes you may find some of them being stored in some other pharmacy where it is not approved to be kept, because those who might be required to ensure or enforce the law and regulation as to which drugstore stores what might not do that as they expect to do it. So that's why they are available sometimes outside of the hospital. And then because sometimes the people who are in the custody of selling this medication may not be too careful enough to follow the rules.
Yeah, they are particular about making money, not the health of the person.
These are the reasons why the drugs are available in places where they ought not to be available.
That's quite sad because even yesterday we saw a very young girl who was just speaking things on the road, talking to herself. She was half naked and all of that. And somebody said it was drugs, that he knows the girl very well. It's so sad. Now, what are the health implications of substance abuse? You know, substances like alcohol, marijuana, you name it. There's so many.
Yeah. So the commonest, one of the common items that people take in our environment, which when you see people on the street that they take them, you probably may not worry too much, is cigarettes. It's very common around us. And that, we can begin from there. It has its own health implication. And it begins from the fact that somebody has to put the cigarette on the lips and light it, and then inhale the smoke of it. In that smoke, there are a lot of items or ingredients that affect the airway. In fact, beginning from the mouth, through which they smoke it, the tongue, the throat, going into the airway, and then of course it ends up in the lung. From the lung, some of the items in the smoke are extracted and absorbed into the bloodstream. So you could have problems of the airway, infections of the airway. You could have problems of infection of the airway. You could have things, the common cough, upper respiratory tract infection. They can occur in the airway for people that take substances that they take through the nose. So this will apply to any other substance that people smoke or inhale as a form of smoke. So the problems of the airway is there. And of course, the problem of the airway could be an infection, like I said. And then in the worst case scenario, people would actually develop a cancer in the airway because of the ingredients contained in the smoke that they ingest. So this airway could also affect, of course, the lung. And of course, a lot of problems of cancer of the lung is a worst case scenario. There are a few other problems that may not necessarily be straightforward cancer that may be triggered by the presence of this smoke in the airway. If, for example, somebody is prone to having asthma or any other respiratory problem, chronic airway problems, they can be triggered and become worsened off when people continue to smoke. So this affects the airway for smoking. And when the agents of the smoke gets into the body, it can affect the cardiovascular system and other parts of the body. So that's for cigarette, for example.
Okay.
Of course, it stains the lip, stains the fingers of the people, stains their tongue and their teeth and all that. So that's common. And then again, if you look at other things that people take cola nuts, some people take it as a recreational item, but for some people it may become excessive and also stain their mouth, their tongue, and their teeth and all that. But looking at the other common thing, alcohol. Alcohol is a very common one.
Very common, it's everywhere.
Yeah, so when people take alcohol, initially people take it to maybe to feel good among friends, but when it becomes abnormal, it may actually cause some people to feel a little excited. So in the initial form of the impact of alcohol, when people say they are drunk, the person who is drunk may not necessarily begin to stagger and to talk out of points, but it may begin with just some feeling of being excited and euphoric. So it happens like that. And then the person may begin to make promises that may not actually stand, to the point where the amount of alcohol becomes too much and the person is no longer in control of himself in terms of what he says, how he reacts, and how he behaves, and his ability to coordinate himself. So such persons may say things that may cause trouble among friends, or they may run into accidents because they are no longer able to control themselves. And of course, like we know, driving under the influence of alcohol makes not only the person who has ingested the alcohol to be prone to accident, other passerby and other road users are also at risk. So these are very important. But beyond that, in the body of the person who takes alcohol, one very common problem has to do with one of the organs that manage alcohol, and that's the liver. The liver has just a law to handle in removing toxins or dangerous chemicals from the body. So if if the liver becomes overwhelmed, then there could be problems. The liver can fail when it becomes overwhelmed. It can actually fail. And then in other worst case scenarios, the liver can also develop some other abnormalities like what we call growth in the liver. The worst case of it is the cancer of the liver, which can result from a prolonged use of alcohol. So the liver is at risk. Of course, those who take alcohol also are at risk of developing problems in their hearts, in their blood vessels. If they had hypertension before, it can become more aggravated. And of course, when there's hypertension has a lot of effect on all parts of the body. Is it the brain? Is it the kidney? And all that. So the impact of alcohol goes from the behavioral problems that come with it to the problems that affect the various organs of the body. The brain is not spared from the impact of alcohol also. Of course, people who take alcohol over time may develop some form of problems of memory in their brain. So there are memory problems that are related to alcohol use, particularly a chronic, a long-term use of alcohol. So for all intents and purposes, there's no benefit really. Most times there's no good benefit because most people are not able to control the use of this substance, so there's no benefit. So we have looked at cigarette, we've looked at alcohol. There are a lot of other substances that have impacts. Common in our environment in recent time is India hemp. And one of the very obvious problems that we see with India hemp is the fact that people tend to lose their mind when they use India hemp. And that's a major common thing that we find around us. In fact, for many people, you may not know they take India hemp, if not because they lose their mind. So that's a major health problem that goes with the use of India hemp.
Okay, let's look at the use of those substances, whether prescription drugs or otherwise, by pregnant women and nursing mothers. I've actually seen girls of this days. You see some of them, I've seen a couple of them somewhere taking what they call shisha, and these are supposed to be pregnant women, about 2 of them. Okay, and I was like, of course you can't speak to people anyhow on the street these days. You don't know who is with them, you don't know what's going to happen next. And I got to them and I was wondering, why would a pregnant woman want to smoke or do some kind of drugs, not considering the child? What may happen to that child and even the pregnant woman?
Yeah, okay, so most people who are pregnant women who take substance are not likely to begin or to have started the use of the substance in pregnancy. They might have been taking substance all their life before then. So pregnancy just comes along the way, and when somebody has a habit of taking a particular substance, it is difficult to now be able to control it when she becomes pregnant. So it's just a natural extension of what has been happening before. The effect of this substance may vary from one substance to the other. But the normal effect of it on the normal adult body is the same for virtually everyone. It's the same. We have itemized some of them. But for the developing baby, generally as a rule, it is advisable that pregnant women avoid all medication except the ones that are prescribed by the doctor. Virtually all medication, even the normal medication that are used in the hospital, it is advised that a pregnant woman will not take any one of these ones except the doctor prescribes. And so doctors would prescribe when it is absolutely necessary to use medication. So if we talk about drugs generally that are even safe in the hospital, the doctors are careful with pregnant women how much more substance that people abuse. They tend to have a lot of
particularly
impact.
the harmful
Yes,
ones.
a lot of impact on the developing fetus. So by all means, there are a lot of issues that goes along with that. There are, alcohol, for example, tends to cause a lot of developmental problems in babies. Okay, it will cause a lot of issues in the developing fetus. And even if the woman was not even exposed to so much alcohol at the initial part of conception, towards delivery, there are a lot of problems that also go with that child. So we've seen babies that come up with alcohol fetal problems that are obvious in them when they are born because their mother are said to be drunk or they take too much of alcohol while pregnant. So it's a lot. It will affect the development of the baby. It will affect a lot of issues in the various organs of the body of the child as the child grows. And of course, whether we like it or not, there has been a lot of documentation about the fact that substance use may have a familial tendency, short of saying there could be some genetic part to it. So it also means that if you have a parent that takes substance and also gives birth to a child, somewhere along the line, if the parent do not stop to use the substance, even after the birth of the child is exposed to that habit and may learn it from the parent. So a lot is at stake, actually.
That's what I said. There's this question that has been begging for answers from some persons. I've asked quite a number of persons the same questions. How do people get addicted? How?
Yeah, people oftentimes don't start out being addicted. People start out taking drugs, or sometimes we call them substances, for recreational purposes. People go to a ceremony, drinks are served, alcoholic drinks are served, and so you take. And then in the midst of friends, sometimes the influence of friends is what introduced a few people to the use of substance, one substance or the other. So your friends will encourage you to take. And in some environments, if a man does not take alcohol, it is considered that he's not a man. So in the midst of such friends, you are compelled to take alcohol to feel along or to feel a sense of belonging. So it begins from there. And so a sip today may turn into a glass tomorrow. A glass tomorrow may turn into a bottle in a month's time. And of course, a bottle that happened only during the occasion on weekends, that happened once a month, may become every weekend. And then as time goes on, the person discovers that beyond drinking in the midst of his friends in occasions, he may have to decide sometimes to buy a drink when he comes back from work at home to relax and cool his nerves. And so it becomes more. The frequency of use now begins to increase. And then it gets to a point that the person discovers that every day he has to take something to relax. And then it goes beyond that to a point where even at work, when he's stressed up at work, he thinks that the only way to ease up the tension is to take alcohol. And so it gets to a point that even some people waking up in the morning, before they can get ready to do anything to feel good, they begin to take some alcohol. So that's how it develops. It begins from a gradual process of recreational use to the point the people now become so used to it.
Is it treatable? Is it something that can be treated, and how long can it take?
So substance use problems and addiction generally, they can be treated, but they can be quite challenging to treat. That is the truth. Quite challenging to treat.
Okay.
And success in treatment, to a large extent, is determined by the individual who is concerned and involved in this problem. His or her willingness to be helped. We call that motivation. That is a willingness to change. If the person is not willing to make a change ab initio, it may be difficult to bring about that change that is required. So this treatment is possible, and then how long it takes, it may actually vary from one person to the other. How strong their motivation to change is, and the kind of support that they have around them, and the extent that the individual is willing to go to make sacrifice and effort to change. But when we have a problem, of somebody who's truly and indeed addicted to a substance. Depending on the center where the treatment is going to take place, the treatment may range between 6 weeks to about 3 months, in some centers to about 6 months. It depends on how bad the situation is and the protocol and the plan of treatment that is being considered for this individual. So that's how treatment is available, and it does last for a long time. And then for those who are really committed to it, they may be able to come out of it. Of course, the treatment also goes beyond the time they go into hospital anyway, because there's a place for admission into hospital for treatment. It goes beyond that point to the point after they have been discharged also, what they make of life beyond there. So in treating them, it's not just the hospital aspect. There's a whole lot about even their home environment, their work, their social life, a lot of modifications that would have to be made. We would have to consider what led them to the use of the substance in the first place, and try to see how they can do away with such things that will remind them or make them to want to go back to the use of substance. So treatment is available. It could be quite challenging. It takes time, but it's very possible.
You are from UPTH. Is
Yes,
treatment available there?
Yes, it's available in UPTH.
Okay, and is it affordable too?
Yes, well, it's affordable.
But there's something that people don't like doing, like a result from substance abuse that may lead to some brain damage and all of that, you know, some psychological problems, so to speak. Maybe, shall we like calling a substance abuse disorder? Let's just use it that way now, because I don't want some persons to get angry, you know. They see their persons getting so deep into it to the point that the person begins to lose memory, the person begins to behave like somebody is already, like somebody is on the street already, like mad somebody and all of that. Such a person, can they be treated?
Yes, they can be.
And then how come people don't take advantage of this treatment to take their persons to the hospital?
Okay.
It's so difficult, because you see quite a lot of young men and young ladies on the street. Let me use Benin, for example, on the streets of Benin, particularly inside the GRA. You just sit them and then you feel so sorry.
Okay. Treatment is available, and to go for treatments, the truth is that depending on the individual, we have people who come on their own to seek help. But when an individual is not able to do that, if he or she has concerned or family members that are close and are caring enough, they may take the person for treatment. But in doing this, they have to, these family members needs to be able to make an effort.
Okay.
Because sometimes the effort can take a long time, and sometimes these persons may not appreciate the effort of the family from the beginning. So these family members must be willing to commit. They must be willing to commit time, effort, resources, and be able to have a lot of long suffering to do that. So usually, family members or friends will bring an individual with substance use problem to the hospital, and they can get help. But along the line, we've seen people who, families and friends who get tired because this person has had the same problem, they've gone to hospital severally, he or she goes back home and the problem continues. They may feel that they are tired, they may think that the person is not making enough effort on his or her part to overcome the problem. So there's what is called the burnt out. People get burnt out, family members get exhausted because of the burden of care, because of the weight and the load of caring for their loved ones that they now feel that they can no longer cope with. So the burden of care can be quite huge on family members sometimes, and that may make them to give up on caring for their loved ones. So that is the reason why along the line, some of them are now left on their own. And when they are left on their own and they're able to help themselves, the habit just goes on, and of course, the cascade of the mental health challenges goes on, and it becomes more complicated as time goes on. They may be on the street and a lot of other problems may result.
All right, Doctor, we're going to take a very short break now. When we come back, we will continue with this discussion. Please stay tuned. Thank you for staying tuned. We're back now and we're ready to shoot. We did say that we will be talking about substance abuse and of course phone addiction. These are the two major things that are troubling most youth. Even some adults are, you know, into all of this too. So I've been talking to Dr. Aina Israel. He's a consultant psychiatrist from the University of Benin Teaching Hospital, and is here to educate you and I on the dangers, health dangers of substance abuse. And he said so much, so much. All right, we're going to use the next 10 minutes, Doctor, to finish what we started. So we've talked so much about substance abuse, and you've advised us accordingly. Well, what about those who will always relapse after going for treatment?
Okay, so if an individual relapse, that means the habit, he or she goes back to the habit.
To the habit.
There's always room for help. The individual, if he or she is willing, could always go back for treatment. Actually, the treatment of substance use problems or any form of addiction does not end. There's an acute part of the treatment, and then there's a continuous part of the treatment. So the initial part of the treatment, which require probably sometimes hospitalization, that's admission to the hospital, is not the end of it.
Okay.
So beyond the time of the intensive care in the hospital, there's also the part of the continuous care, even beyond the hospital, that's the follow-up.
Okay.
So it is during this period of the follow-up that a few people may have either some slips of times that they found themselves going back to the substance, or they finally relapse. Even if this occurs, they should still go back to the hospital and continue treatment.
Okay,
so help is available.
Thank you. Let's look at the health implication of phone addiction. Does it have any health implication?
Okay, so phone addiction has to do with the use of the smartphone to an extent that it causes problems for both the individual and then the significant others around him or her. Yes, there are some health problems that can be associated with phone addiction.
Okay.
For example, we could find that people who have this problem would tend to spend most of the time on their smartphones. This will mean that they will not give enough time to attend to other important activities.
Okay.
So if he's a student, the student may find himself or herself spending more time on the phone than to attend to the core academics that is required in school. The implication of that is that he or she will not perform well in school, in the exam, in the test, assignments may be left undone, and so the outcome of the education may not be as good as an individual who is well focused.
Okay.
So you could have that on one side for the individual who is a student. And then of course for the individual who is in the working class, the quality of their work and the ability to pay attention to the task given to them would also be affected, because even while at work, they will find themselves engrossed with their phone. They have to check something again and again. There's a message they have to check, something they have to reply to, a lot of distractions there. So their productivity at work would also be affected because more of the time is spent with their smartphones. Now, beyond the part of direct school and work aspect, in our everyday life, the time the individual ought to rest, there's a possibility that the phone may also may be found in that space and take up all the time. So it is very common that people who have the problem of being addicted to their phone may spend hours on end on their phone, and they may use their phone into the evenings, into the night, into the period of time they ought to rest or sleep. So the impact of that is that they may not sleep on time. There's delay at going to bed, and of course, if there's delay at going to bed, it also means that waking up in the morning will be unduly delayed. They may not wake up on time, they may be late for their activities in the morning. Apart from that, they may also find out that the phone, if they are so engrossed with it, may even wake them up in between in the night because of some messages that come in, the alert that come in, and that may wake them up. So there could be interruption in their sleep because they've learned not to put these things away and to do without them. So their sleep may be interrupted, intermittent sleep may occur, and at the end of it all, the quality of their sleep is not good enough. When the quality of sleep is not good enough, the housekeeping effect that sleep does on the body and on the brain will be lost. Nature has provided sleep for it to bring forth restoration of everything about the human body back to normalcy before we start a new day. So it's called the housekeeping effect. That will be lost. So in the day following the previous day, the person will not be refreshed to start the day. And when the day is not started on a good note, you can be sure that many things may not go well that day. So their get up and go is poor. Their concentration at work or whatever activities they are doing is poor. They may tend to make more mistakes, more error. They may tend to have accidents because they're not being careful enough, because they're not refreshed, because they've not had a good sleep because of the impact of the phone. So all these are problems that can occur. Of course, on a daily basis, people are advised not to use their phone while operating machineries or driving. If somebody is addicted to the use of phone, those conversions and carefulness and those precautions may be lost, and so the person is prone to accident and injury. So these are a lot of issues that may actually result from the prolonged use of the phone. Now, in terms of the brain specifically, it's been documented that the impact of addiction on the brain is common to all items that people are addicted to.
Okay.
So when people are addicted to alcohol, the impact of it on the brain in terms of some aspects of the brain, some sections of the brain, the impact of it is the same for all addiction. So there's a part of the brain that's called the gray matter that is said to be affected, tend to undergo some decline in their functioning over time when people are addicted. So the ability of the individual to be productive and to be at their best will be impacted upon over time because of this addiction. People become a bit more restless, they become a bit inability to be patient, they cannot carry out their tasks as expected, they're not as productive as they should be, they're not having the cutting edge they used to have as an individual because of some addiction that they have. So these are a lot of other issues. Now for the phone, a lot of other social problems come up with it. The information we get and many of the media, social media that people also use by reason of being addicted, and some other forms of, well, business that comes up somehow. Some legitimate business, some may not be legitimate. We're interested in the ones that are not legitimate. That some people who are addicted to their phone may find themselves in by reason of constant exposure, and they're not able to control these things, gets people into trouble and may get them to begin to explore some aspects of life that are not acceptable, that will eventually end them into problems.
Is it possible to get them out of this addiction?
Yes. Like for any other addiction, the individual who is concerned or affected must be willing to be helped.
Okay. The willingness is the key.
Very important.
Word there.
Very important, because, like you know, most of these things that people are addicted to, whether we like it or not, in an individual's personal space, he or she would have the liberty to indulge in these things. For example, the phone is a necessary thing in our world today for us to communicate and do other things. So everybody has got a phone most of the time, and therefore the educated, most people have got a smartphone. So I must be disciplined enough to be able to know my usage and the pattern of usage that is accepted, that is appropriate for me. So even if an individual has got an addiction, even if he or she is helped, it gets to a point that he or she has to take a decision and a stand to want to use these items and substances in the right way, if at all he or she must. So that personal determination is so important in getting to overcome the problem. This would be enhanced by the form of formal treatment that he or she may have an access to over time.
All right, Doctor, I guess this is where I'm going to let you go, even though I don't want to, but I want to say thank you for finding time to be with us here today on the program. Hopefully, when we call you again, you will oblige us.
It's my pleasure. Thank you very much for having me.
All right, people, this is what we're going to do today on the program Healthy Living. Thank you for watching. Bye-bye.